So speaking of Ozempic and Wegovy, these are, two of the biggest things I see pop up whenever we post about Wegovy or Ozempic. People always start fighting in the comments. It seems like a very controversial subject. As a diabetes educator, what can you tell us about Ozempic and Wegovy? How it helps your patients and everything like that, because I think there is so much misinformation. I'll admit I've fallen for it at times, but what is the real purpose of these and why are people so upset about them all the time?
So I am a weight neutral practitioner. I do not harp on people's weight. It is, again, something that is largely out of our control. And another thing to consider is that diabetes or weight gain is a symptom of type 2 diabetes and sometimes type 1 diabetes, just because insulin and all of these hormones get messed up it just makes it difficult. So it does not necessarily mean that the adiposity itself is the cause of everybody's issues here. So the fact that we advertise Ozempic and Wegovy or prescribe them for people with diabetes to lose weight is problematic because if the person isn't losing weight, they're going to feel really awful about it and upset. And then B, they may stop taking it because they're like, where's my weight loss? When it's doing so much more than that. With both types of diabetes to certain degrees, but especially in type 2 diabetes, you have GLP-1 resistance. And this is another hormone that is thrown out of whack when you have insulin resistance as well. So that's why we need so many different medications. Oftentimes we need the metformin for a certain purpose. We need the insulin for a certain purpose. We need the GLP-1 for this purpose. Because we're resistant to GLP-1, we're going to add that in. And what GLP-1 does is it helps to keep your stomach from releasing the food too quickly, which can help regulate your blood sugar. More importantly, it really helps with the elephant in the room when it comes to type 2 and type 1 diabetes, and that is the liver. The liver is doing all kinds of crazy stuff, and it needs to calm down. So liver, for whatever reason, we're not even entirely sure why it happens, but after meals in anybody with diabetes, the liver decides to dump glucose into the bloodstream. And that obviously is going to make our blood sugar a lot higher than it needs to be. So that's really one of the biggest issues with diabetes and postprandial excursions like that. So the GLP-1 it tells the liver to quit it and not do that because it's inappropriate. So that is the biggest use of the GLP-1s like Ozempic, Trulicity, Mounjaro, and Victoza, and Rybelsus. And the weight loss may or may not happen because it is helping a little bit with some of that insulin resistance. It's also keeping your postprandial blood sugars from going up as high, which means you may use a little bit less insulin, which results in a little bit of weight loss. Again, just because you're less resistant. So that's what I try to tell people. The biggest issue we see is people are losing their appetite completely and losing weight that way. And that is not ideal. That's similar to starving yourself. And unfortunately, you really have to advocate with the doctor. Because I've asked patients, I'm like, yeah, you're eating 500 calories a day. Have you told your doctor? And they usually have. And the doctors are just like, well, you're losing weight, so it's great. That is not the right answer. We want to lose weight in a way that is sustainable, and eating very, very low calorie like that because you lost your appetite, it is a side effect that we want to adjust the medication so that you're not having that side effect. It should not completely wipe your appetite. If anything, it should just make it a little less, you're less ravenous, because diabetes can make you really hungry, because we talked about that. You need some carbohydrates. So yeah, definitely. That is not, people think that's the point of Ozempic and Mounjaro, but it is a side effect we don't want. So if that's something you're experiencing, you should definitely be like, hey, we need to lower this dose or try something different.
Gotcha. So basically it's one of those things where it's like, it's made in earnest to help diabetics. And then people are like, oh, it'll make you starve yourself. And it kind of becomes this big thing. Like,
It is a medication induced eating disorder. So like it's just crazy. Like we're giving people this med and we're totally okay with them starving themselves because it's a medication, which is just wild to me. And yeah, and the other thing to consider too is these GLP-1s, you have to stay on them forever, for as long as you have diabetes. Some people may be able to come off of it, possibly. But most of the time we need to stay on them. We do have some trials that show similar to any type of weight loss. If you go past 5 years and you stop using the medication or you stop doing what you're doing, you will gain that weight back and then some more. So again, it's a hormone that you're missing or you're not producing well, and we have to replace it. So that's really just the way to think about it. It doesn't mean you're doing anything wrong or it's a temporary fix. It's just something we have to replace because your body needs it.